Hello and welcome to Talking General Practice, the podcast from GP Online. I'm Emma Bauer, the editor of GP Online. Today on the podcast, I'm talking to the National RCGP Registrar Co-Chairs Dr Tom France and Dr Molly Dineen about the issues currently facing GP registrars across the UK. Coming up, Tom and Molly talk about the ongoing GP jobs crisis and the intense frustration surrounding underemployment and unemployment at the end of GP training. They explain their concerns about GP jobs under the Additional Roles Reimbursement Scheme and stress the importance of a fully funded detailed workforce plan from the government to address the mismatch between rising training numbers and available jobs. Tom and Molly also outline their key priorities for the year ahead in their role, including greater consistency in training and the urgent requirement for better visa sponsorship support for international medical graduates. And we explore how GP training might need to change and what they would like to see from policymakers to ensure general practice remains an attractive and viable career for the next generation of doctors. I'm delighted to be joined on the podcast now by Dr Tom France and Dr Molly Dineen, who are the National RCGP Registrar Co-Chairs. Tom is an ST3 registrar in Wigan in Greater Manchester, and Molly is an academic GP registrar, also in her third year of training in Bristol. Thank you both for coming on the podcast.
Thanks very much for having us.
Great to be here.
You both stepped into this co-chair role for the RCGP for a one-year term. What made you want to take on the leadership role at this time? Maybe, Tom, let's start with you.
There's lots of challenges that GP registrars are currently facing. There's a lot of work to be done, really. I've been involved within the college for a couple of years. I joined the Northwest faculty a couple of years ago when I was an ST1, and then I spent the last year as the vice chair nationally. I think we both felt that we wanted to use our previous roles to continue to sort of address the key issues GP registrars are facing to hopefully improve the experience for our colleagues.
And Molly, what about you? Why did you decide you wanted to put your hat in the ring to do this?
Very similarly to Tom, I really feel like this is a time of massive uncertainty for registrars, and if I could do even a small bit towards kind of reducing some of that for my colleagues, I want to try and help. We also felt that we're both approaching the end of our training. This is a really excellent leadership opportunity, an opportunity to kind of develop our leadership skills and get a bit of experience in this kind of area. So I think we both felt that we wanted to grasp that opportunity.
There is an RCGP Registrars Committee. What does that do as a whole and how does it fit into the college?
The Registrar Committee is made up of GP registrar representatives from all kind of 32 faculties across the UK. And we come together to discuss basically the key issues facing GP registrars at that time. So registrars tell us what's working, what isn't working, and we can take that up to the college to try and kind of raise some of the most pressing issues. I guess our key role is to represent registrars on the RCGP UK Council, and we have 2 votes on council, so to represent registrar views along with our vice co-chairs who are also supporting us to chair the committee. So that's our kind of key role. But we also represent registrars on a number of other kind of committees. So for the Academy of Medical Royal Colleges and at the GMC, the National Recruitment Office. So we really can take whatever concerns are raised in whatever direction they need to be taken. So it feels like quite a responsibility. There's thousands and thousands of registrars, and we hope to try and represent them as best we can.
What are your key priorities over your year in office? Maybe, Tom, do you want to start with that one? What are you going to be focusing on in this role?
As Molly mentioned, we've got 2 co-vice chairs this year, so there's 4 of us to the price of 2. So we've got Alex Abel and Aman Shamsi, who are both based up in Yorkshire. We're trying to be ambitious, given we've got double the manpower. We've sort of split up into 5 key priorities. We'll maybe outline sort of 3 of them. One of the things we're looking at is GP training and how we make it more fair, the best quality it can be, and more consistent across the UK. There's a lot of variation in training experiences, be that kind of study leave allowances, time people get for teaching sort of delivered as part of the programme. So we're looking at doing some work on trying to get more consistency between the deaneries for registrars. There's also a national postgraduate medical training review underway, which is being led by Chris Whitty and people in NHS England. So we're really keen to kind of use that as an opportunity to look at how GP training can be changed. There's lots of opportunities there. And as Molly mentioned, we have a seat on the National Academy of Resident Doctors Committee. So that's an opportunity for us to look at changes there. Generally, we want to see more time spent in primary care and training, a discussion about the length of training potentially as well. So lots of work to do there. I think also we want to look at making sure there's strong representation for GP registrars across the college. We make up about 1/3 of the college membership, GP registrars, which is obviously a significant number. So we want to make sure that registrars are being represented within all sort of forums of the college. We're very lucky to have Victoria Giorgio Brown, who's the new chair of council, who's really supportive of the GP Reg voice. She's already been really proactive in involving us in wider discussions and various things. So so that's really positive, and hopefully that can be a productive thing.
I guess our third priority is to kind of look at workforce sustainability and thinking about kind of equity and career progression. It's a massive concern at the moment about having employment at the end of training, and specifically for our international medical graduate colleagues who've had concerns about getting visa sponsorship when they finish training. So that's going to be a large area of our work as well. So looking at how we can sustain a workforce and make general practice a career that people feel secure in and an area they want to stay in for the rest of their careers. And then our kind of final priorities are looking just to improve the value of being an RCGP member, because we know that not everyone continues their RCGP membership beyond training, and we really want to make RCGP membership worthwhile and good value for money. So we've been doing a lot of work looking at that. And finally, looking at how we can make training as inclusive and safe as possible, especially for those with additional needs. So to try and make training as flexible as possible to suit as many people as possible.
Let's talk about the jobs crisis, because obviously that's a really pressing issue facing GP registrars at the minute. That's particularly true for GPs in their final year of training like yourselves. But even GP registrars starting out are quite worried about whether there's going to be jobs for them to go to.
Yeah, this is a real concern. And I think it's a real frustration that, we've been training for many years to be a GP, and you finally get to the end and you finally get to that position that you've been training for and you're not employable, which just feels really frustrating and not fair and not a good use of that kind of spending to have trained us. So lots of frustration, lots of apprehension. There's been some data that's started to be collected about this, and there is real evidence to show that the people are struggling to find work. I think one survey recently showed that 1 in 4 of all GPs, not just newly qualified GPs, had been looking for work in the last year and were struggling to find a position. So that's really concerning. I think registrars are feeling that they are relying on being employed by one of their training practices. So in a survey we did in Severn, we showed that nearly 80% of registrars who had a job were being employed by somewhere they trained. And that's quite a difficult position to be in as well, because it certainly changes the dynamic during training. Lots of registrars are going less than full time for a whole variety of reasons, one of which might be the concern about employment. Registrars are going abroad, and surveys have demonstrated, 65% of registrars thinking about going abroad, which is huge numbers. So this is a real concern. I think underemployment is as big, if not more of an issue than unemployment, where GP registrars or GPs are finding work. They're not finding as much work as they would like. So they might be finding a role, but it might be only 1 or 2 days a week when they would be willing to work 3 or 4. And that's a huge number of GP appointments that we're kind of losing the possibility of having. And in Severn, we've shown that about half of registrars who found work would have worked more sessions than they could find. So there's a huge, workforce that we're not utilising. And I think that's really disappointing when these are highly trained, highly skilled individuals that we should be, there's patients who want to see GPs and GPs that want to see patients, and that's not matching up, and that's really frustrating.
It's just ridiculous. We did quite a bit of work last year to bring this to the forefront of the college's work, and previous chair Camilla Hawthorne was very supportive in getting a lot of work going, because the hard thing we had was there wasn't loads of data to show the extent of the issue. One of the things we did was a survey of practice managers, which is sort of the first time the college has done something like that, which did show, I think about 60% said that they wanted to expand the workforce, but about 90% said there was a lack of funding stopping them from doing that. So it's a real issue. There is an opportunity where I think deaneries are now running sort of exit surveys as people finish training. And so we're hoping if that data sort of shared, that will capture some good real-time data of where people are going, if people are getting jobs, what jobs people are getting, is it underemployment, is it unemployment? There's been some positive steps, but there's still a long way to go. And I think frustration is the overriding feeling, really.
There is regional variation in this as well. And one of the things that has come up when I've been talking to people is that there obviously are places where GPs are really struggling to get jobs, but there are other parts of the country where you can't find a GP for love nor money because they're very under-doctored and there's people who aren't working there. So it's not a uniform picture. So obviously that kind of data that you're talking about from the deaneries, it'd be really useful to help understand exactly what the scale of the problem is and where the challenges are. The government's initial response to all of this has been to add GPs to the additional roles reimbursement scheme. Now, both the BMA and the RCGP have argued that's not the right way to address this problem. What's your view on those ARRS jobs? Do you think they're a good thing for newly qualified GPs?
At least it's being recognised that jobs are needed. So I think, that's a basic positive. But I think we do ultimately feel like these are not necessarily the right jobs for newly qualified GPs. The biggest concerns are that a lot of them are quite short temporary contracts. Some involve fewer hours or less pay than other kind of substantive roles would have. A big concern for me is that these roles are often split between different practices within a PCN, for example. And that can really reduce, consistency of support and mentorship for newly qualified GPs, and really importantly for continuity with patients. So I think the job, it becomes much more challenging. And when you're newly qualified, that job needs to be as supportive and nurturing as possible. So I think it's a real thrown in at the deep end type approach, and still contains a lot of uncertainty for registrars. We kind of fundamentally agree with the college's position that funding should be given to practices with core funding so that they can have autonomy about how they use that money to employ GPs. And we think that would be a much more sustainable approach for both practices and newly qualified GPs.
Tom, obviously there's been changes to the contract that's going to come in from April, which means that the ARS will be opened up to more experienced GPs as well as newly qualified GPs. I mean, up till now, it's been only GPs who qualified within 2 years, and so that limit's going to go. And also there's this new ring-fenced fund to recruit GPs, which is going to go to practices. What's your thoughts on those changes? How do you think they're going to affect GP registrars in the next few years?
Both are definitely positive things. I think more money for more GPs can only be a good thing. With regards to the expanding hours, it might be that some of these jobs split between sites, working in sort of social care settings, are perhaps more fitted for more experienced GPs, and perhaps the newly qualified GPs should be going into practices. Obviously, there's huge variation in the roles. But, both are positive steps. Some of the details obviously remain to be seen. The ring-fence funding is obviously, again, a good thing. Obviously, this isn't new money. This is repurposed money, which is already going to practices from PCNs. So it sort of remains to be seen what this will add in terms of jobs, or if this is just moving existing money to pay the same GPs. But it is a positive step regardless. Obviously, there's the NHS long-term workforce plan is due to come out at some point. I think keeps getting moved back. We need to keep lobbying to have a clear plan, really. GP training numbers are increasing, but we're not seeing the follow through with more jobs at the end of the road. So we just need to see a clear, joined up, fully funded plan for how these jobs will be expanded. So yeah, I think a positive step, but probably we want to see them go a lot further, really.
And what do you think the government does need to do to actually properly address the workforce crisis?
I think we just need proper planning, proper future detailed planning, and be able to commit to real solutions that address those plans. So, for example, I don't think the government is sure how many GPs we need, what a safe ratio of GP to patients are in the UK. We're way above what we would probably consider a safe standard of GP to patients. So we need to really map out, how many GPs we need. Are we training the right number of GPs to meet that plan? And then are we creating enough jobs to, deliver that? So I really hope that the workforce plan does detail that a bit more than it has previously. We've got lots of bottlenecks. As Tom said, we're training more and more medical students, more and more general practice registrars, but not necessarily following that through with more jobs and more space to facilitate those jobs. Estates is a real limiting factor, particularly as we expand medical student and GP registrar numbers. So we need to create the capacity to deliver those extra jobs. So I would just like to see it mapped out in much more detail and put some real logic behind how, the exact number of GPs that we need, and then to put some money behind that.
I think the other thing is, as you mentioned, Emma, there's also a question about where the jobs are. And one of the things that we were disappointed to see in the last couple of years since we've had this Labour government has been they've taken away the TERS funding, which basically an incentivisation for entering GP training in sort of underdocted areas. I'm sure there are arguments for that, but clearly those areas are underdocted still, and we're now not incentivising people to train there. So I can only assume that it will follow that there'll be less people wanting to work there. So there are wider ways to think about this. Ultimately, we just need to see a plan and a commitment, and the college is looking to do a lot of work under Victoria's leadership and to look at things like GP to patient ratio and hopefully have a good, robust evidence base with which we can lobby government to say how many GPs we need, and so it's not kind of finger in the air when they're making these plans.
I would also just really like to see the conversation shift from safe minimums and safe standards and what's the minimum number of GPs we need to deliver care to, and flip that discussion to how do we deliver high quality care? How do we deliver really good continuity? How do we deliver personalised relationship care? What do those numbers look like? Because I think for a long time we've just tried to survive on the bare minimum, and that's not a way to deliver an effective healthcare system and not a way to sustain your young and energetic and newly qualified GPs if they're just going into an environment that's purely survival.
I know the college is obviously one of their big pushes has been, and I think it will be the same under Victoria. It was definitely a big push for Camilla, is about GP retention as well. And when we talk about retention, obviously we often think about GPs further along in their careers, experienced GPs who are leaving the workforce. But retention can be a real challenge for newly qualified GPs as well, can't it? If they come into the workplace and it's just so demanding, so demoralising, all the stuff you hear about moral injury. So retention is really important for early years GPs as well, isn't it?
Yeah, and you spoke about lots of GP registrars going kind of less than full time. And yes, for sure, one of those reasons might be the concern about employment. But one of those reasons is definitely the current environment. Even as a registrar, it's really brutal. You know, we're seeing lots and lots of patients, really challenging patients, sometimes with not adequate supervision because of the numbers of registrars coming through and not having enough trainers to support them appropriately. So, you know, people are burning out before they've even got to the end. And I think we need to really protect GP training as somewhere that's really safe and you can be adequately trained to prepare you for future work. So I think that's already happening at a really early stage, and that's quite concerning to see.
Not to be the doom and gloom talking about everything that's been taken away from us since we've been trainees. We've seen the post-CCT fellowships, new to partnership, all these kind of retention schemes be pulled, which all of this is adding up to, I mean, me as someone who is looking at applying for jobs now for August, and it's just really stressful, and it just feels like the goalposts have moved massively even since we started training. It feels like a lot's been sort of unfairly taken away, which was there for a pretty good reason, really.
We talked about this expansion of the GP training places, and a lot of that has come from a big increase in the number of GP registrars who are international medical graduates. At the minute, they make up around half of all GP registrars. What are your thoughts on the government's plans to prioritise UK medical graduates for specialty training? This has come about in response to concerns from resident doctors, but do you back this, and how do you think it's going to affect general practice?
We completely understand the rationale, and we have a situation where competition ratio is massive. I think for GP it's 5-1, and other specialties it's significantly more than that. It doesn't make sense that we've got UK graduates who are going through medical school and unable to get jobs at the other side. It's a sensible and reasonable piece of legislation, I think. Our probably unique perspective, as you say, is that we have a significant number, over half of our registrars are international graduates. And I think the slight nuance here that's maybe missed is that while we have a high competition ratio, I don't think this is necessarily in general practice because we've got UK graduates not able to get into training because international graduates are. The high ratio, some of that comes from people putting down applications for multiple specialties. So that doesn't necessarily reflect the actual number of people wanting to do GP or getting into GP. I think one of our concerns is that this legislation coming in, and I think unfortunately some of the rhetoric that has been there in the build up to it, my worry is that we're going to put more international graduates off applying, and we actually probably don't have enough UK graduates wanting to do general practice. So I think that is an area we need to think about, and how we promote general practice as a specialty. And I think regardless, we need to think more broadly about how we're supporting our IMG colleagues. There's been lots of work we've both been involved in around difficulties with people getting visa sponsorship at CCT and things. So I think this legislation is positive. I think it's sensible, but I don't think it's going to sort of solve lots of issues for us in general practice.
You mentioned there about the visa issue. Your predecessor, who was the RCGP registrar chair, he ended up having to leave the country, didn't he, to work in Canada because he couldn't get a job with a visa sponsoring practice. I know the college has been one of the biggest advocates for changing the rules and regulations on this. What are you guys doing specifically on this issue?
This work really kicked off last year when Tom was in his kind of vice chair position, and we're certainly carrying that on. So continuing to kind of lobby the government to try and grant indefinite leave to remain to those who are qualifying as GPs, especially for our international medical graduates that are currently training and may not be able to stay in the country when they finish their training. We're looking at that. But we're also looking at what the college can do to support practices to become sponsoring practices, what they can do to support. There's a lot of work to do to become a sponsoring practice. So I think the more colleges can do to support them, the better. But you're right, we're in an absolutely really sad situation where a GP registrar like Dr. Akram Hussain, who contributed to the college, who contributed nationally as GP registrar, co-chair, wasn't able to stay in the country because he wasn't able to find a job and get visa sponsorship. And what was really disappointing to hear is that as soon as he applied in other parts of the world, that those visa sponsorship issues just were solved like overnight. He had a visa. So we really need to work on the practical issues. So we're looking at that with the college. But I think it's also important to highlight that this is only going to get worse. We've got got more and more trainees coming through the system. We've currently got, as you say, 50% of international medical graduates amongst our registrar colleagues who may not have sponsorship at the end of their training. So we really need to try and do this as a matter of urgency. So we are lobbying as much as we can.
There's a lot of rhetoric at the moment generally in the public about immigration and things. And I think part of our work last year, and we collaborated with the BMA on this quite successfully and culminated in a letter to the Home Secretary, is that this shouldn't be tied into a wider conversations. These are people who've been allowed to enter GP training. As I mentioned, I'm not sure that the changing legislation is necessarily going to mean we're suddenly seeing the population of GP trainees change significantly. And regardless, we've got international colleagues who are new to the NHS who are going to be in the situation in 3 years because they're already in training. So I think there's still a role to try and lobby government and really get the message across. I was really heartbroken to see Akram go and work with him for a year. That's such a shame to see such great talent go to Canada. Why should they get it? We know there's lots of other anecdotes and registrars who contacted us who are in similar situations or planning to move abroad because they know what it's going to be like when they finish.
Let's talk a little bit about GP training as well. So in the past couple of years, sort of come across this idea of blended learning in GP training. Can you explain a bit about what that is and how it's being rolled out? Is it in all parts of the countries or is it only in certain areas?
So this is a kind of a new innovative approach to training, which has come about for kind of a variety of reasons, but one of which we believe is probably to manage the increasing capacity of GP trainees that are coming through the system. What it's specifically referring to, that are actually now called structured learning placements. So during general practice of training, obviously we get rotated around different placements. And so you would spend a 4 to 6 month placement doing a structured learning placement. And that would mean spending part of your time in general practice, but the other part of the time in the week doing either self-directed learning or kind of structured learning in small groups. There is some evidence about the benefits that brings, kind of more dedicated theoretical learning time. There is some evidence that it might improve kind of exam scores and things like that. Equally, we do have some concern that the registrars in these placements are kind of spending more and more time away from clinical practice. And some of the issues that we've described about capacity and supervisors, numbers and things might have driven that change. But it is a new way of training. It's been in a pilot phase and is now kind of gradually being rolled out. I think it's now in 11 different deaneries across the country. So it is kind of becoming more and more something that we're seeing registrars do.
It's a term, blended learning, sometimes is used to refer to sort of how the half-day release teaching is delivered. We've kind of met with colleagues in NHS England, tried to speak to registrars, had positive and negative things to say about them. Our concerns are sort of centrally about replacement of clinical time and really the motivations for that. As Molly said, there are evidence still coming out about these placements and the benefits, but there's sort of reported benefits that they may help certain groups of registrars, like people who are new to the NHS. But equally, they're being rolled out quite rapidly and in varying ways. So some deaneries we're seeing they're being targeted to certain groups, whereas some sort of they're being allocated at random. So essentially, we're bringing a motion to the RCGP Council to essentially just ask for a conversation about this, to bring stakeholders together and for the college to facilitate a discussion to review the evidence for these placements and essentially ensure that they're evidence-based, they're being run consistently, sort of address our concerns, really.
When I was at the BMA LMC's conference, there was a motion about this. Basically, the concern was that it dilutes GP training. Is that something that you're worried about?
I think it's really important to highlight, we have such a short training program. We're expected to be GPs having trained for 3 years. We have the shortest training program, and I would argue the most difficult specialty. We have the broadest kind of scope in the patients that we treat and the conditions that we see. Even in 3 years of clinical facing time, it's a really challenging training program. And even within those 3 years, in parts of the country, you only get either 1 year or 18 months in general practice. So you might be in kind of hospital roles for the first year of training, and then you only get 2 years, 18 months, even 1 year in general practice. And that might be the first time you've ever been in general practice, having been through medical school and foundation years. So we just feel concerned that it might take away from patient-facing time in general practice, and that our priority would be to get more clinical-facing patient time in general practice, and this potentially contradicts that move. We do appreciate the theory and needs to come around that, but we do think there's nothing that's probably can be replacing one-to-one patient time in general practice, and that really is how you get the best training. And that's what the college's message has been for many years. When it comes to our assessments, when it comes to our workplace-based assessments that we're doing, it's all about evidencing our communication skills and our management of patients. So we think that message stands strong, that that's the best training that you can get.
Tom, you mentioned earlier that you're involved with this review of postgraduate medical education, which Chris Whitty's running. How would you like to see GP training change in the future? For example, do you think we should move to 3 years for everyone in general practice? Do you think we need longer GP training? And how do you think it all needs to change to reflect this move towards neighbourhoods?
Certainly more time in general practice is needed. Scotland, they still only spend a year in general practice, which is just madness. I know our colleagues in Scotland are really trying to use the upcoming election as a way to sort of lobby for that change. So in other regions of the UK, we do get 18 months, but still, as Molly said, a lot of people, that'll be their first time in general practice. There is value in the secondary care posts we have, the experiences you can get from working in various settings of secondary care. But I think the importance is it's got to be addressing clear learning needs. My ST1, I did a lot of repeated posts that I'd already done during my foundation training, and it wasn't hugely valuable, some of it. You end up kind of doing what we sort of probably call more service provision type roles, which there probably always is going to be, there is a service that still needs to be run, but when you're not learning a lot and you're just sort of on an on-call rota, how much value is that within a very short training post? So I think more time in general practice, yes, but also the time out of it needs to be addressing the individual registrar's sort of gaps in training, really. Training length, I think we're quite keen for a conversation about that. That's been had in the past, and I think the college has had a position that probably we need to look at whether training should be longer, but clearly there's a big funding issue there. There is a real gap. We talk a lot about parity of esteem, and is it appropriate that for GPs we get 3 years and other specialties get up to 8 years, for example? Probably we need to look at, are some programs too short, are some too long? So yeah, those are definitely things we want to look at, and we're keen, we are proactively sort of starting a conversation within the college about that, so that as the postgraduate medical training review continues, we're sort of ready and the college is ready to engage, really.
And it might be that these structured learning placements can create an opportunity there. I mean, we feel that maybe it's not appropriate to be squeezing them into a 3-year program, but maybe it's the answer to making it a 4-year program. So we certainly want to kind of use that as a way of exploring innovative ways that we could extend training. That might create an opportunity. So it might just be that they're a good idea, but maybe placed in a different model that we need to look at.
And is there anything specific in GP training that you think needs to change? Over the years, there's been lots of talk about the fact of how important it is for GPs to have leadership skills, and I've spoken to other people who think that maybe there's not enough in the GP training program to basically for people to understand how general practice works and like running a practice if you want to be a partner. And obviously the level of care, the kind of complexity of patients that you see in general practice is exponentially getting more difficult as time has gone on. So and trying to cram all of that into a 3-year program is pretty challenging. Is there anything in the actual curriculum you think needs to change to better reflect the times we live in now?
Part of our assessment, in addition to exams, is our workplace-based assessments of e-portfolio, and there's stuff in there about sort of quality improvement, leadership. I sit on the college's workplace-based assessment committee, and there's very practical conversations about how we make sure that those assessments are meaningful. I agree. I think, do we come out of training knowing enough about running the business of GP, which it is, and whether you become a partner or not, you're still going to be engaged in some element of that, or if you're a locum, you sort of have to manage your own finances. And again, I think some of this is very varied across the UK. Different regions do things very differently, but we possibly don't do enough of that. And there's an opportunity, I think, as we move towards the neighbourhood NHS, whatever that's going to look like. And again, I'm sure very different in different areas. I would hope that will lead to more opportunities for GP registrars to be at the heart of engaging with quality improvement processes and leadership opportunities. But I think it's not at the core.
Yeah, I'd also just have to add, as an academic trainee, I mean, in general practice, we are massively underrepresented, in terms of clinical academics. We have so many fewer GPs doing research than any other specialty. That massively needs to change if we want to demonstrate, high quality evidence for how we need to change general practice. A lot of the stuff we're discussing today, we need more evidence for in order to prove where the spending should go and the impact it's having on patients, for example. And we need the GPs in order to be skilled to do that. So I think there's a massive opportunity to expand research experience in general practice training. There's only 2 of us in Bristol, for example, that do academic training. Why not create more roles for people to have 4-year training programs with research built in? And of course, that takes more funding as well. But I think it's a really good opportunity there to future-proof, because we do need that research coming through.
You mentioned the e-portfolio. There's been some problems with that recently, hasn't there? The BMA's raised some concerns about it. What exactly are those problems and how are they being sorted out?
We spend a lot of time with our e-portfolios in general practice training.
Yes.
We have 2 big exams,
Yes.
but the majority of evidencing our competencies and things, it is through the e-portfolio. So when it doesn't work, it's incredibly frustrating. And there have been a number of issues. I think There's been lots of changes to the systems, which we haven't necessarily had kind of appropriate notification of, which has impacted people completing assessments and going through ARCPs and things like that, which is obviously really frustrating. And there's also been changes to kind of who can complete assessments and needing supervisors to create login accounts and all these added barriers, which just make it even harder to tick the boxes, basically. And it's hard enough to tick all the boxes in GP training as it is. So we just feel like maybe more and more barriers are being put into place. We have raised our concerns with the kind of Optum who run 14 Fish, which is the e-portfolio. We've raised our concerns, with the college. And there is a lot of work being done to look at kind of how suitable, as Tom said, we're looking more generally at kind of what the portfolio needs to do to meet the needs of kind of future GP trainees and registrars. But we also need to look at practically, is it the right software to be using? Is it kind of fit for purpose? Because it's really how we evidence that we're ready to be GPs. We're spending a lot of time at the moment gathering kind of what the specific issues are and working out whether that, we can make the appropriate changes or whether we need to look at kind of alternatives. So yeah, something we hear a lot about from GP registrars.
I suppose the last question, if you could wave a magic wand and get one commitment from Wes Streeting, all the health secretaries in the other countries, because obviously you represent doctors across the UK, that would improve the life of GP registrars and all their future prospects, what would you want to see governments do? Wally, do you want to go first?
I think, as you said, it's that question of the future. For me, it's kind of recognising that, primary care manages like 90% of patient interactions, but the proportion of spending in primary care is significantly less than secondary care. And for me, it's just the government recognising that the role of primary care in kind of prevention of disease. We know that good relationship-based continuity of care between patients and doctors is the answer to delivering high quality care for patients, sustainable careers for doctors, lower spending costs for healthcare systems. And so I just want to see that recognised and see that shift in investment into primary care, because I think that is where we're going to be able to deliver an efficient and effective health system. But at the moment, that just doesn't feel recognised.
And what about you, Tom? What would you like all these politicians to do for GP registrars?
I want to say something practical, like more parking spaces. Wes Streeting recently offered to pay for college fees and exams through his most recent offer to the BMA resident doctors. And I think it'd be great to see him follow through on that regardless, because that's obviously a significant expense that resident doctors have regardless of specialty. I think for us in primary care, just as we've talked about, a clear strategy for how they're going to invest money for jobs and space, really, so that all the things we've been talking about barriers to getting jobs, lack of space with increased training numbers, that uncertainty goes, and it makes general practice look like, for lots of other reasons, but it will help to make it look like the attractive specialty, which we both know that it is, and encourage more people to want to do it and not worry about getting a job at the other end.
Yeah, definitely. It's so important. Nobody seems to want to grapple with the estates problem, but it is a real issue, and it's hard to see how you can train more GPs, how we can have a GP workforce that's kind of fit for the future and the demands of the future without the actual space to put them in. So, they're both very good things that you've suggested there.
We'll do our best in 1 year.
That's brilliant. Thank you, Tom and Molly, for coming on the podcast today. It's been really great talking to you. Thanks for your time.
Thank you so much.
No, thanks so much for having us, and we appreciate the opportunity to represent registrars.
Well, that's it for this week. Thanks for listening, and thanks again to Molly and Tom for speaking with me this week. I'll be back next week for our regular news review, when we'll be talking about the results of the BMA referendum on the GP contract for England and what happens next, so please do join me then. In the meantime, don't forget you can keep up to date with all the latest news affecting general practice and access lots of other resources on our website at GPonline.com.